Hi, and welcome to System Science and Obesity. My name is Jessie Jones-Smith, and I'm an assistant professor at Johns Hopkins Bloomberg School of Public Health and one of several instructors for this course. I wanted to take a couple of minutes to introduce you to this class and give you a little bit of an idea about what to expect from it. Together, we are going to take a look at the obesity epidemic from a public health and system science perspective. The global obesity epidemic represents one of the most challenging public health issues of our time. Despite a substantial increase in scientific work and public awareness around obesity treatment and prevention, no country has successfully reversed their obesity epidemic. The researchers that you'll hear from have put together this course because we feel that the global obesity epidemic has reached a critical point and new methodologies need to be applied in order to reverse this crisis. This is where systems thinking and systems approaches come in. So rather than focusing on a single factor that we might intervene upon with hopes of making a dent in the obesity epidemic, from a systems viewpoint, we consider the entire system or systems of factors that may converge and interact to produce such high levels of obesity. We think that approaching the obesity epidemic in this way may lead to more fruitful and lasting solutions. So this course serves as both an introduction to systems thinking in the area of obesity and as an introduction to three core methods used in system science, namely systems dynamics models, social network analysis, and agent-based models. So specifically, this course begins with a rather intense and in-depth look at the proposed causes of the obesity epidemic and a rationale for incorporating system science into our study of obesity. The ideas presented in this section are rather dense, and this might be a good place to take advantage of the discussion board to hash out any questions that you might have about the lecture with your classmates. So after that, we delve into the nuts and bolts of systems dynamics models, and we have a laboratory component where you'll get to apply what we talk about in the lectures to begin building a systems dynamics model. We then discuss the role of neighborhoods, social connections, and social networks and economic resources as they relate to obesity and how we might begin to consider them in these systems dynamics models. We end with a lesson on agent-based models. And here again, we include a laboratory component so that you can apply what you learn in the lecture to begin building an agent-based model. So I hope you have a good idea about what to expect from this class. Welcome, and we truly hope that you enjoy it.